To understand hepatic portal vein, first let us understand what is a portal vein. So portal vein are the large venous channels. So they are the veins. They are veins and therefore they are containing venous blood. So these are the large venous channels. They are called portal because they arise in one set of capillaries and another set of capillaries. So it becomes a very important question that can be asked in the viva, that why are the portal vein called so? So we called portal vein, and how are they different from the normal veins is that portal vein begins in one set of capillaries and ends in another set of capillaries. To understand it further, let us take help of this diagram and understand the difference between the normal circulation and portal venous circulation. In a normal circulation, what happens is that the heart pumps its oxygenated blood into the arteries. Via arteries, it goes to the capillary bed where the exchange of nutrients takes place. The oxygenated blood is consumed and the carbon dioxide which is produced by that organ or gland is released into the blood. So till now the blood that was rich in oxygen and nutrients has now become rich in carbon dioxide and waste products, and now this blood is known as deoxygenated blood. The deoxygenated blood is then carried with the help of a veins back to the heart into the right atrium. From right atrium it goes to the right ventricle, then it goes to the lungs where there is gaseous exchange occurring and various metabolism of the waste products also occur at the level of lungs. The oxygenated blood, the blood becomes again rich in oxygen, so it becomes oxygenated. It gets pumped into the left atrium, and from the left atrium into the left ventricle, and then again via left ventricle again the oxygenated blood is pumped into the arteries, and this is how the cycle goes on. So this was the normal circulation. But what happens in a portal circulation? In portal circulation, the heart pumps the oxygenated blood via arteries. These arteries then end up in one set of capillaries. For example, these capillaries are ending at the level of, capillary bed is formed at the level of stomach. So we have stomach over here. This is stomach. Okay. Now these capillary blood, instead of the blood from the stomach now is not going directly into the via veins into the heart, but it is going with the help of a vein into another set of capillaries which will take it to another organ, that is liver. So what all substances that are being present, that are being exchanged at the level of stomach? For example, the stomach contains digestive enzymes. So these digestive enzymes and the deoxygenated blood with the products of digestion will now enter into the liver with the help of a vein known as the portal vein. So this portal vein is a connection between, it is beginning at one set of capillaries and it is ending at the another set of capillaries. Now, and then it is going to the liver where the further metabolism will take place. The liver acts is a very important metabolic organ. It causes detoxification of various waste products, and whenever this process of detoxification and metabolism is finished, then this whole blood is collected via the hepatic veins, and then it goes into the inferior vena cava, and then via inferior vena cava it goes back into the heart. So it is again entering from the portal vein, the blood again enter into the systemic vein and enters into the heart, and the cycle then repeats. So this is portal venous system. So why do we need portal venous system? Portal venous system allows direct transmission of substances from one organ to the another organ without spreading it throughout the systemic circulation. So the product of digestion from the stomach will remain in the portal venous system rather going into the systemic circulation. Then these products will go to the liver and then in the liver the process of detoxification will take place, and after detoxification the deoxygenated blood will be then carried by the systemic vein back into the heart. So portal vein connects prevents the spillage of the substances into the general circulation. So there are various sites of portal venous where portal veins are present. For example, hypophyseal portal system is present in the brain, and then there is hepatic portal system. Hepatic portal system forms the very important portal venous system, and whenever it is not mentioned which portal system we are talking about, and it only mentions about portal venous system, we assume it that they are talking about the hepatic portal venous system. So it becomes very important for us to understand that what is hepatic portal venous system, how the gases how the exchange of material is taking place at the system, how is the portal vein at this at this hepatic portal system formed. So in the next slide we will discuss about the formation formation of the portal vein. Now, what is a portal vein? So the portal vein is formed, it is important, first of all, it is a very important venous channel. It is containing venous blood, it is very clear. Then the portal vein is about 8 centimeter long. So it is about 8 centimeter long. 80% of the blood that flows through the liver is via the portal vein. That is, the 80% contribution of the blood supply to the liver is via the portal vein. It is a valveless vein. Okay. Now, if we talk of the formation of the portal vein, let us look at this diagram. We can see that there is a vein known as the splenic vein, and then we come to another vein, that is the superior mesenteric vein. These two veins are coming and joining together at this level, you can see over here. Okay. So the splenic vein and the superior mesenteric vein, they come together and unite behind the neck of pancreas. Now this sentence becomes very important because it is telling you the location of the portal vein. If you have to find where the portal vein is located, you have to search it behind the neck of the pancreas. Pancreas is an important organ. It is a gland. It is an endocrine as well as an exocrine gland, and the pancreas has certain parts. It has got a head, a neck, a body, and tail. And behind the neck of the pancreas, we will find that there is a venous system present, and this vein is the portal vein. So again, to emphasize, how is portal vein formed? Portal vein is formed by the union of splenic vein, which is carrying the blood from the spleen, and superior mesenteric vein, which is carrying the deoxygenated blood from the large intestine, from the ascending colon, from the transverse colon, from the different part of colon, you can say. So it is carrying the deoxygenated blood from here, and the two veins are coming together and they are joining behind the neck of the pancreas to form the portal vein. So here we can see that there is the initiation of the portal vein. Portal vein formation is being initiated. If we talk about the vertebral level that it corresponds to, so this formation of the portal vein is behind the neck of the pancreas, and in terms of vertebral level, this corresponds to the L2 vertebral level. I think it is clear till now. Now, what is the function of a portal vein? The portal vein collects the blood from the abdomen and the pelvic part of the alimentary canal. Alimentary canal or the whole digestive canal. Okay, so the abdominal and the pelvic part of the alimentary canal, the blood from the abdominal as well as pelvic part of the alimentary canal, it is collected by the portal vein. Then other organs from where the blood enters into the portal vein are the gallbladder, the spleen, and the pancreas. So the blood from these organs, from the abdominal part of the alimentary canal, from the pelvic part of the alimentary canal, that is the stomach, duodenum, jejunum, ileum, that is the abdominal part, and the ascending, transverse and descending colon, sigmoid colon and rectum, that is the pelvic part of the alimentary canal, blood is collected, and then the products of digestion which are present in the alimentary canal, for example carbohydrates, proteins and other nutrients, they are they are carried via the superior mesenteric vein, and the product of RBC destruction from the spleen. We know that spleen is the graveyard of RBCs. So the product of RBC breakdown are taken via splenic vein, and the vein and the two veins, the superior mesenteric vein carrying the carbohydrates, proteins and other digestive products, and the superior mesenteric vein carrying the products of RBC destruction, enter into the spleen for further enter into the liver via the portal vein for further metabolism. Okay. Now we have to understand about the course of the portal vein, that how is it formed and what is the course of the portal vein. So we can see again in this diagram that we have a superior mesenteric vein over here and splenic vein over here. These two veins are coming together and are fusing behind the neck of the pancreas. This yellow colored structure that you are seeing is the pancreas. Okay, this is pancreas. This is pancreas. This is the head of the pancreas. This is the neck of the pancreas, the constricted part. Then we have the body, and then we have the tail of the pancreas. So pancreas has head, a constricted narrow part known as the neck, then a body, and then tail. So pancreas is a J-shaped structure, or you can say retort shaped structure. Okay, what is retort? Now you must have seen in the in your chemistry labs that retort is a instrument that is used for distillation. It contains a body, a circular base, and then it has got a long stem. Okay, it's got a long stem and it is used for distillation. So similarly we have pancreas. The pancreas is a gland which contains the head of this pancreas lies in the C of the duodenum. Now these details will be covered in the separate lectures, but for the understanding we are drawing it over here. So we have over here, this is the duodenum. It is a C-shaped structure and it has got 4 parts. Okay, so this is the first part, this is the second part, this is the third part, and the smallest one is the fourth part. So the pancreas is lying, head of the pancreas is lying in this C part of the second part of the duodenum, and then there is a constricted part known as the neck, then we have body, and then we have tapering end known as the tail, and this tail seems to enter into the hilum of the spleen. Okay, if this is a spleen, so the tail seems to enter into the hilum of the spleen. So, and it has another process known as the uncinate process, which lies below the main bulk of the pancreas. This is the uncinate process. So the this was about pancreas. Now how is it related to the portal vein? The superior mesenteric vein and the splenic vein, they come together and they unite, as I have shown it in the diagram in a dotted structure, that the splenic vein and the superior mesenteric vein, they are coming together and are uniting behind the neck of the pancreas to form portal vein. Then it runs upward and little towards the right. So this is the, if we divide the body, if we see the quadrants, so the liver, we know it lies in the right hypochondrium, and where the portal vein has to go, it has to enter into the liver. It is very clear. Okay, so imagine this is liver. Okay, so it is the portal vein, after the formation runs a little towards the right, first behind the neck of the pancreas, then behind the first part of the duodenum, and lastly it enters the right free margin of the lesser omentum. So it is, let us see what we are talking about. It is formed behind the neck of the pancreas, behind the neck of the pancreas, behind the first part of the duodenum. This is the first part of the duodenum. So the spleen, portal vein is formed behind the neck of the pancreas, behind the first part of the duodenum. It is running upwards. Okay, the direction is upwards. You can see over here the direction is upwards and towards the right side of the body. Then it enters into the liver by dividing into the right branch and a left branch. Okay, so this is how it terminates. So the portal vein, the course of the portal vein, it runs upwards, little towards the right, behind the neck of the pancreas, then behind the first part of the duodenum, and lastly in the right free margin of the lesser omentum. Then it enters the liver by dividing into the left and a right portal branch, and enters the liver with the help of via porta hepatis. Now what is porta hepatis? This will be then dealt in the lecture of liver, so I'm not going into detail about that. Then inside the liver, the branches of the portal vein, the right and the left portal veins, they break into sinusoids. They are drained into the hepatic vein, and finally they enter into the inferior vena cava. Now another important thing that you have to pay concentration on is that the flow in the portal vein is slow, and it is called streamlined flow. What do you mean by the streamlined flow? Streamlined flow means that the blood that is coming from the superior mesenteric vein drains into the right side of the liver or the right lobe of the liver, and the vein that is coming from the left side, that is the splenic vein, is draining into the left lobe of the liver. And to understand it better, let us see this diagram again. See, I have taken two different colors to show you how the blood is entering, how the blood is not changing its stream. The superior mesenteric vein, it is present on the right side, and the splenic vein, the spleen is present on the left side. So the splenic vein is carrying the blood from the left side. So the superior mesenteric vein is carrying the deoxygenated blood from the descending part of the colon, the transverse colon, the ascending colon, and this from the right side of the body. And this structures from the right side of the blood coming from these structures from the right side of the body enters into the right branch of the portal vein, and the blood that is coming from the spleen, that is the left side of the body, it is going directly into the left branch of the portal vein, and it is draining into the left lobe of the liver. We know that the liver is divided into two lobes. It has a right lobe and a left lobe. So the superior mesenteric vein is carrying the blood via the right portal branch into the right lobe of the liver, and the splenic vein is carrying the blood from the left side of the body, and it is draining it into the left lobe of the liver via left branch. So this such flow is known as the streamlined flow. Okay, now we have discussed about the formation and termination of the portal vein. Now let us understand what are the different parts of the portal vein and the relations formed by these different parts. So we have divided the portal vein with respect to duodenum. You can see here that this is duodenum. This orange color structure here, this is duodenum. Okay, so the portal vein, we have divided the entire course of the portal vein into three parts. First is the infraduodenal part. So what is the infraduodenal part? Let me highlight it with a different color. Okay, let me take this color. This part. Of the portal vein. Okay, this is the infraduodenal part. Okay, then the infraduodenal means it is behind the duodenum. It is below the duodenum, inferior to duodenum. So this is the first part of the duodenum, and the infraduodenal part is this greenish part. Then we have the retroduodenal part. Now what is a retroduodenal part? The part of the portal vein which is present behind the first part of the duodenum. So it should be drawn with the help of a dotted line over here. This is the retroduodenal part. This green part is the infraduodenal part. Okay. This part is the retroduodenal part because it is lying behind the first part of the duodenum. And thirdly, we have the supraduodenal part. The supraduodenal part is lying above the level of duodenum. So now we have seen that we have divided the entire course of the portal vein into, with respect to duodenum, into three different parts. That is the intraduodenal part, retroduodenal part, and the supraduodenal part. Okay. Now first let us understand what are the relations that are formed by these different parts of the portal veins. So the intraduodenal part, you can see it over here. Okay. Okay, I'm going to show you with a highlighter. I'm going to use a highlighter over here. So this is the intraduodenal part. Okay, so it is related anteriorly. We have drawn this part with dotted line. So this dotted line represents, where I have not filled the color, it means that it is lying behind the pancreas. So the structure that is present anterior to the portal vein or the intraduodenal part of the portal vein is the neck of the pancreas, and the structure which is present behind the infraduodenal part, that is posterior to the portal vein, in the infraduodenal part is the inferior vena cava. Now inferior vena cava is this. Okay, and I want all of you to remember that the inferior vena cava is present behind the portal vein throughout its entire course. So no matter which part of the portal vein we are talking about, whether it is infraduodenal or it is supraduodenal or it is retroduodenal, the posterior most structure will always be the inferior vena cava. Now what we have different is the anterior structure. So every part has a different anterior structure, and if you remember the diagram, then you won't have to mug up the things. You can easily remember that the infraduodenal part, that is the part of the pancreas lying below the duodenum, has what? Pancreas in front of it. So the anterior part is the neck of the pancreas. Then in the retroduodenal part, because the name suggests it is lying behind the duodenum, retro means something that is behind. Retro means behind. So retroduodenum means behind the duodenum. So the retroduodenal part of the portal vein means that the portal vein is lying behind the duodenum. So this is the retroduodenal part, this one. Okay, and this is lying behind the first part of the duodenum. Okay. Then what are the other structures that are present anterior to the retroduodenal part of the portal vein? There is bile duct, which I have shown with the green color, and we have shown you an artery known as the gastroduodenal artery. Okay. So this is the gastroduodenal artery. And we have another structure that is lying in front of the retroduodenal part. This is the green colored structure known as bile duct. And the most important structure that we all know is the duodenum. So duodenum is lying anterior to it. Okay, duodenum is lying anterior to it. I hope this is clear. Then we come to the supraduodenal part. Supraduodenal part means the part of the portal vein which is lying above the duodenum. So this part, which I am going to highlight with a different color now. this blue color highlighted part is the supraduodenal part. Okay, so the the structures that are present anterior to the supraduodenal part of the portal vein are the hepatic artery and the bile duct. The hepatic artery is lying towards the left side. So this is the hepatic artery. Which is lying anterior to the supraduodenal part on the left side. And then we have bile duct. This green colored structure is the bile duct, which is lying on the left side, towards the right side. So we have the hepatic artery on the left and the bile duct on the right, in front of the supraduodenal part of the portal vein. And posterior, as we all know, in the entire course is what? Inferior vena cava. So the posterior will be, there will be no change, it will be inferior vena cava. So now we have discussed the three different parts of the portal veins, that is the infraduodenal part, first infraduodenal part, then second this is the retroduodenal part, and this third one, that is the supraduodenal part. And what are the structures that are present anterior to these three different parts, and what are the structure that is present posterior to these three different parts. And we have very important thing to know over here. It is easy to remember for all of us that and throughout the entire course, inferior vena cava is present posteriorly. Okay, so this diagram is a key diagram that you should all learn to draw and reproduce it in the exams. Now let us come to the branches of the portal vein. So now we have discussed that after the formation, the portal vein is dividing into two branches, the right branch and the left branch. See over here. I have messed up the diagram a little bit, but I hope you people understand. See, this is the okay. See, this is the right branch and this is the left branch of the portal vein. The right branch of the portal vein is comparatively shorter and wider, and the left branch of the portal vein is comparatively longer and narrower. So the portal vein is ending into the portal vein ends into the right branch and left branch. It enters into the liver via porta hepatis. Okay, now porta hepatis is present on the posterior surface of the liver. It is, if we see the posterior surface of the liver, I actually didn't want to go into the detail of the porta hepatis, but I just want to tell you, suppose this is liver and this is a J-shaped area. This is porta hepatis. Okay, and three structures enter, or we say that there are three structures that are entering and exiting through this porta hepatis. So it is acting as a port, as a gate. Okay, so what are the structures that are entering and what are the structures that are exiting? So the bile duct is exiting through the porta hepatis, and the hepatic artery and the hepatic vein is and the portal vein is entering via the porta hepatis. So the two structures that are entering are the two branches of the portal vein, the right branch of the portal vein and the left branch of the portal vein. This is entering into the porta hepatis. Another structure that is entering into the porta hepatis is the right and left hepatic arteries, and the structure that is exiting through the portal vein is the hepatic duct. Is the bile duct. So these three structures forms the portal triad. Okay, and we will discuss it in detail when we discuss about the liver. So for now, the important thing that is important for you to remember is that the portal vein ends in the right and at the right end of the porta hepatis by dividing into the right and left branch, and which enters into the liver. The right branch is short and wide, and it receives a vein known as the cystic vein before it enters into the right lobe. So if I draw in the same diagram, before entering into the right vein, into the right lobe of the liver, the right branch of the portal vein is receiving a branch known as the cystic vein, and after the cystic vein opens into the right branch of the portal liver. And similarly, the left branch receives another vein known as the paraumbilical vein. So the left branch is receiving paraumbilical vein before it enters into the liver. Okay, so this is the left branch is longer and narrower, and it receives paraumbilical vein, and after receiving this paraumbilical vein, it enters into the left lobe of the liver via porta hepatis. So the right branch is receiving which vein? Cystic vein, right before it enters into the right lobe of the liver, and the left branch of the portal vein is receiving which vein? The paraumbilical vein, right before it enters into the left lobe of the liver. Okay, so these are the branches of the portal vein. Now let us talk about the tributaries of the portal vein. The tributaries of the portal vein are, as you can see in this diagram, there is a left branch, there is a left gastric vein, there is a right gastric vein, then we have superior pancreatico-duodenal vein, we have paraumbilical veins, okay, we have the splenic vein, and we have the cystic vein. So what are the different tributaries of the portal vein? The different tributaries of the portal vein are the left gastric vein, right gastric vein, superior pancreatico-duodenal vein, paraumbilical vein, cystic vein, splenic vein, and the superior mesenteric vein, and out of which splenic vein and the superior mesenteric vein are the formative tributaries. That is, they form the portal vein. So this was about the tributaries of the portal vein. I hope it is clear by now that what is a portal vein, what is the length of the portal vein. It is about 8 cm. Where is it formed? It is formed behind the neck of the pancreas. It corresponds to the formation. This formation coincides with the L2 vertebral level. Then it ascends upwards towards the right and divides into the right and the left branch. The right branch of the portal vein enters into the right lobe of the liver, and the left branch of the portal vein enters into the left lobe of the liver. The flow of the blood inside the portal vein is streamlined. Then this is a valveless vessel. The blood flow via this vessel is slow, and portal vein begins in one set of capillaries and it ends in another set of capillaries. So all these are very important points that you must remember about portal vein. Now we have to come to the very important topic, that is portosystemic anastomosis, also known as the portocaval anastomosis. Portosystemic anastomosis or portocaval anastomosis are basically, there are certain sites in the body where the portal vein comes in contact with the systemic vein and they anastomose with each other. So there are various sites, and the mnemonic to remember the sites of the portocaval anastomosis is long live Bapu. Bapu, Mahatma Gandhi, you all know. So long live Bapu. L stands for the lower end of the esophagus. Another L stands for the ligamentum venosum. B of Bapu stands for the bare area of the liver. A stands for the anal canal. I have forgot to mention that, so I'm mentioning over A here. A is the anal canal. Then we have B stands for the bare area of the liver, A stands for the anal canal, P stands for the posterior abdominal wall, and U stands for umbilicus. Okay, so the mnemonic is long live Bapu. Lower end of what are the sides? Lower end of the esophagus, ligamentum venosum, bare area of the stomach, anal canal, posterior abdominal wall, and umbilicus. Now, if we look at this diagram, it will be easy for you to understand the various sites of the portocaval anastomosis. Now, whenever we are dealing or we are discussing, for example, it comes in the short note that what is right about the portocaval anastomosis and its clinical significance. So you will have to mention the different sites of the portocaval anastomosis and what are the different vessels that are coming together to form this anastomosis. So you will have to mention the portal part of the portocaval anastomosis and the systemic part of the portocaval anastomosis. Now to discuss this in detail, let us look at this diagram. Now first we have discussed that the first site is the lower end of the esophagus. So this diagram over here, this is given in BD Chaurasia in second volume. The lower end of the esophagus over here, esophagus continues as stomach, we all know. Okay. So this is the lower end of the esophagus. And this lower end of the esophagus is getting a portal part. The portal part is contributed by the left gastric vein. So the portal vein that is coming that is anastomosing is the left gastric vein, and the systemic vein that is coming is the esophageal vein. You can see over here, this is the hemizygous vein, okay, and this is the esophageal vein. So the esophageal veins of the systemic vein and the right and the left gastric vein of the portal vein, they are coming together and anastomosing at the lower end of the esophagus to form the portocaval anastomosis. So this becomes the first site. So the first site, the lower end of the esophagus, the portal part is the left left gastric vein, and the systemic part is the and the systemic part is contributed by the esophageal veins. Okay, so this is the first site of the portocaval anastomosis, that is the lower end of the esophagus. Now the lower end of the rectum or the anal canal. So look at here. So the superior rectal vein. See, this is the superior rectal vein. This is the portal vein. That is a tributary of the portal vein. See, this is the splenic vein, which we all know will contribute into the formation of the portal vein, and it is giving a tributary. So this tributary, the superior rectal vein, is the portal. It is the tributary of the portal vein, and we have the middle and the inferior rectal veins, and the middle and the inferior rectal veins are coming from the division of the inferior vena cava. So these are the systemic part of the portocaval anastomosis, which is taking with the site is the anal canal. So at anal canal, the systemic part is contributed by the middle and the rectal vein, and the middle rectal vein and the inferior rectal vein, and the portal part is contributed by the superior rectal vein. Okay. Then we have umbilicus. Now umbilicus, you can see it over here. Umbilicus is here. Okay. So the portal part of this, the portal vein that are contributing to the formation of the portocaval anastomosis at the site of umbilical are the paraumbilical veins. You can see it over here in this diagram. These are the paraumbilical veins. which are we all know that these paraumbilical vein, they open up into the left branch of the portal vein before entering into the liver. So this is the this portal vein, a tributary of the portal vein is the paraumbilical vein, and the systemic part is contributed by the veins of the anterior abdominal wall. So the veins of the anterior abdominal wall. These are the veins of the anterior abdominal wall. They are coming from the, they are contributing the systemic part. So they come together around the umbilicus. So this is umbilicus. We are here, the portal part is the paraumbilical vein, and the systemic part is the veins of the anterior abdominal wall, and hence this becomes the site of portocaval anastomosis. That is, umbilicus becomes the site of portocaval anastomosis. Now we have the posterior abdominal wall. Posterior abdominal wall, we have the splenic vein as a portal vein and left renal vein as the systemic vein. Then we have the bare area of the liver. The bare area of the liver has the portal vein as the portal radical and the systemic vein as the diaphragmatic veins. So at this site you will see that there are portal radicals giving it a this is the portal part of the portocaval anastomosis, and then we have, this is diaphragm, and this is diaphragm, and here we will have the phrenic veins or the diaphragmatic veins, and they are contributing to the systemic part of the portocaval anastomosis. Now after this bare area of the liver, we have ligamentum venosum. To understand what is ligamentum venosum, so we have done with lower end of esophagus, we have done with bare area of the liver, we have taken posterior abdominal wall, we have taken umbilicus, we have taken anal canal, and now what is left is the ligamentum venosum. Now to understand what is ligamentum venosum, you must know a little bit about the fetal circulation. So I will not be going into very much detail, but with this diagram I'll try to explain you what happens when we are in mother's womb and how is the circulation taking place. So in fetal life, the ductus, there is a vessel known as ductus venosus, which has to which leads to the bypassing of the liver. So basically liver is not much functional in fetus. So for metabolism, the blood which is coming from the placenta, it has to go to the heart, but we have to bypass liver, and to bypass liver the only option we have is to make another artery patent, and this becomes the ductus venosus. So the blood is coming from the placenta. Just look at the course. The blood is coming from the placenta. Here we have placenta. Okay, so the blood is flowing in this direction. Then from the placenta it is entering into this umbilical vein. Then it is from the umbilical vein, this is the umbilical vein. Now in fetal circulation we know that the umbilical vein is veins carry the oxygenated blood. So the umbilical vein is carrying the oxygenated blood. Then with the this umbilical vein is dividing into the right and the left branch. So the left it is giving the right portal vein and the left portal vein. The left portal vein then continues as ductus venosus, and it bypasses the liver and it directly enters into the inferior vena cava. This is the inferior vena cava which is coming, and the inferior vena cava is carrying deoxygenated blood, and the ductus venosus is carrying oxygenated blood, and here the mixing up of the blood will take place. Then it will go into the via the inferior vena cava, it will go into the right atrium. So this is the ductus venosus, which is patent in fetal life in order to bypass liver. But what happens after birth? After birth, we have a very functional liver, so we do not need to bypass liver, and hence what we'll do, what happens physiologically, this ductus venosus becomes obliterated and it remains as a ligament known as ligamentum venosum. Now this ligamentum venosum, whenever in adults it remains patent, sometimes it remains patent and forms the site of portocaval anastomosis. So you can see over here that this is the portal part, the ductus venosus is the portal part, and the inferior vena cava is the obviously the systemic part, and this becomes, so the ligamentum venosum becomes the site of the portocaval anastomosis. This is another diagram showing you the different areas of the portocaval anastomosis, and again this diagram is taken by from BDC. So we have bare area of the liver, lower end of esophagus, anterior aspect of the kidney, or you can see the posterior abdominal wall. Okay, posterior abdominal wall. Okay, we have umbilicus, we have the anal canal. So these are the sites of the portocaval anastomosis. Now what is the clinical importance of this portocaval anastomosis? First important thing you have to understand about portal vein is the portal hypertension. The normal portal pressure is about 5 to 15 millimeter Hg, that is millimeter of mercury. Whenever this pressure rises or exceeds above 40 millimeter of mercury, it is known as portal hypertension. Hypertension basically means that there is increase in the pressure, tension or the pressure of the blood that is flowing into the portal vein. So the portal hypertension means that there is increase in the pressure of the blood that is flowing through the portal vein. So when we call the patient is suffering from the portal hypertension, when the pressure inside the portal vein rise above 40 mmHg, 40 millimeter of mercury. Now what are the causes of portal hypertension? What are there are certain diseases that leads to the portal hypertension. For example, cirrhosis of liver. What is cirrhosis of liver? Cirrhosis is the shrinking of the liver. Shrinking of the liver. So what happens that whenever liver becomes shrunken, it will cause increased back pressure on the tributaries of the portal vein. So if we come to this diagram, just for the understanding, this is the portal vein. Wait a minute. Okay, this was the liver. Okay, now if liver by any chance becomes cirrhosed or becomes shrunken, what will happen? That it will cause a back pressure on the portal vein. So the right branch, it will cause back pressure on the right branch, on the left branch, then on the portal vein, and then on the portal vein, and then the various tributaries of the portal veins will also there will be rise of pressure in all the tributaries of the portal vein, and hence this will lead to the dilatation of the vessels at the site of portocaval anastomosis. Now what will happen to when there is a dilatation of the vessels at the site of portocaval anastomosis? These vessels becomes dilated, they becomes engorged. At certain sites which are superficial, these vessels are even visible. The dilated or tortuous vessels are visible. And when the pressure, and if we apply a little more pressure, these vessels have the tendency to start bleeding. Okay, so what are the causes of portal hypertension? Cirrhosis or shrinking of the liver. We have a disease known as Bunty's disease. Then thrombosis of the portal vein, that whenever there is an obstruction to the flow of the portal vein, again there will be rise in the back pressure. There will be back pressure on the portal vein because the blood is now not flowing forwards. It is exerting a back pressure, and this will lead to portal hypertension. Now the portal hypertension, as we already know, leads to increased back pressure on the tributaries, and it leads to We know that there is a splenic vein, which is a tributary of the portal vein, a formative branch of a tributary of the portal vein. So whenever there is rise in the blood, in the pressure of the splenic vein, it leads to congestive splenomegaly. So I think there should be no confusion about it. Because we already know that there is an increased pressure, and this increased pressure over increased back pressure over the portal vein will give rise to the increased pressure in the tributaries of the portal vein as well. Let me make this diagram a little static. Okay. So, for example, if we talk about the thrombosis, okay, thrombosis means that there is certain obstruction to the flow. For example, we have certain thrombosed vessel. We have a thrombosed vessel over here. Okay, so the blood is now unable to go upwards. Okay, this upward movement is stopped. So what will happen? The blood is now going to put a back pressure on the contributing tributaries, on the splenic vein as well as on the superior mesenteric vein, and further other tributaries. So the splenic vein, whenever it becomes dilated, or whenever the pressure in the splenic vein becomes increased, it leads to congestive hepatomegaly. It will again, the blood will flow back into the spleen. The spleen will become enlarged, and this is known as congestive. It will be full of blood. There will be congestion of the blood, coagulation of the जैसे कि बारिश में हो जाता है, there is a collection of or pooling of blood. So like collection of water takes place during rains. So whenever we have a lack of proper drainage or a blockage in the drainage system, there will be increased back pressure, and there will be the collection of the blood at different sites. So the spleen becomes congested, and it becomes to dilate. So it becomes to enlarge. So whenever the spleen enlarge, it is known as the splenomegaly, and whenever it is because of the increased back pressure, then it is known as the back pressure of the blood. It is known as congestive splenomegaly. So portal hypertension leads to congestive hepatomegaly. It also leads to ascites. These are the presenting symptoms of the portal hypertension. Whenever the person comes to the OPD complaining, and we diagnose him with the portal hypertension, then we have to look for that. We have to give importance to the clinical signs and symptoms. So the signs are what? Symptoms are something which patients will tell you, and signs are something which will be observed by the doctor himself. So the patient will present with ascites. So patient may complain to you. Ascites can be both a symptom and a sign. The patient will say that his abdomen is becoming tense, and its girth is increasing. तो कहेगा पेट फूल रहा है, ठीक है. So this will become this पेट फूलना or rise of the tense abdomen will become the symptom, and ascites, which is the diagnosis, will be made by the doctor. So this becomes the sign. So ascites is the sign of the portal hypertension. Then when you will look at we will try to observe the different sites of portocaval anastomosis as soon as you inspect the stomach. First inspect the stomach. That as soon as we ask the patient to expose the stomach, the tensed abdomen, we can see that this is the stomach and this is the umbilicus, and we can see that there are dilated tortuous veins all around the umbilicus. Okay, like this. So this phenomena is a very important clinical. It is a very important clinical sign, and it is known as caput medusae. Caput medusae. What do you understand by caput medusae? Caput medusae, basically caput medusae is a imaginary character, I think a Greek or a Latin Greek character, where the Medusa is a female who has a head with radiating hairs. So she has the hair, instead of hair there are snakes on her head, and that snakes are vibrating all over around her head. So it appears that the head, so the caput medusae means that this is the head of the medusa, and these are the vessels, are the hair which are radiating all around. So umbilicus gives caput medusae type of a sign. So this is a very important clinical sign, and it is seen around the umbilicus, and it why do we see such thing? It is happening because the umbilicus is a site of portocaval anastomosis, and due to portal hypertension there is increased back pressure in the portal vein, as well as so the portal veins, the tributaries of the portal vein are becoming engorged at these sites. These tributaries are minute, and what happens that whenever there is increase in the pressure, it leads to hemorrhage. Another site is the lower end of the esophagus. We know that the esophagus is the lower end of the esophagus is the site of portocaval anastomosis. So what are esophageal varices? Esophageal varices means that there is the dilatation of the portal vein of the left gastric vein. We know that at the lower end of the esophagus we have the portal part contributed by the left gastric vein, and lower esophageal branch of the systemic vein becomes the systemic part, and the left gastric vein becomes the portal part. So these two at this lower end of the esophagus, these vessels becomes dilated, and what happens that whenever there is these sites have the tendency to bleed. So the lower end of the esophagus, the dilated vessels, if there is little more dilatation due to any cause, or there is increase in pressure, little more pressure due to any cause, these vessels have the tendency to get rupture, and there will be oozing of the blood, rapid oozing of the blood, and it can lead to a life-threatening situation. So hematemesis is because is blood in vomitus. So the patient after this varices will start bleeding, the blood will accumulate in the patient's esophagus, and then he will start vomiting, and when he will vomit a large amount of blood. So this is known as hematemesis. So hematemesis is also a clinical sign as well as symptom. So the patient may say that he is having blood in vomitus. So this information can be given by the patient. Another very common condition that patient comes to you when he is suffering from portal hypertension is the hemorrhoids. We know that the lower end of the anal canal is a site of portocaval anastomosis. The systemic part is formed by the inferior and the middle rectal vein, and the portal part is contributed by the superior rectal vein. So this is the site of the portocaval anastomosis, and whenever the patient says that whenever he goes to the washroom to defecate, or wherever he puts a little amount of abdominal pressure, he has bleeding per rectum. So this becomes the symptom with which a patient comes to the OPD. So all these signs and symptoms will help us to make us a diagnosis of the portal hypertension. And after saying that the patient is suffering from the portal hypertension, we will try to find out that what is the cause of the portal hypertension. Is it because of the cirrhosis of the liver, that is his liver has become shrunken, or is it because of some sort of a disease, or is it because of the obstruction of blood flow in the portal vein? So then this is to be dealt by the clinicians. Then he will try to rule out the different causes. But the diagnosis of portal hypertension can be made if we have a better understanding of the different sites of the portocaval anastomosis, what are the different vessels that are contributing to the portocaval anastomosis, and what are the signs and symptoms with which the patient appears. So the patient will complain of what? The patient will complain of tensed abdomen, that is increasing in the girth of the abdomen. He will say that his abdomen has become tensed, and this condition is known as ascites. Then patient may complain of blood in the vomitus, and this is known as hematemesis. The patient may present with hematemesis. The patient may present with bleeding per rectum, that is bleeding through while defecation, and this is known as hemorrhoids. And a sign that that doctor is going to see, a very important clinical sign, is the caput medusae, that is the radiating tortuous veins around the umbilicus. So this becomes the important clinical sign. So this was all about the portal vein and